Assalamu alaikum, this is Fatima, the 5th semester psychology student in FCCU, and the video I'm going to make is for Jannah for All, which is a community service platform. The topic for my video is mental health. I'm not going to talk about how important mental health and what the mental health is, but I have chosen a specific aspect of regarding the mental health and some sort of stigma or taboo associated with the mental health. So the very first thing is that there are two words which we have heard a lot in this regard, which is depression and anxiety. If we see someone who is not working well, who is not doing well, who is a bit more sad, and who is a bit more silent, a bit not functioning properly, so we'll call this person as a depressive one. Actually, this is the most wrong thing that we do. Depression can be only recognized or assessed by a trained clinician, a trained person who does assessment and testing, a psychologist or a psychiatrist. Just like that, if someone has some sort of problem in the gut, and you cannot just assess by just observing that, or you have intestinal infection, or maybe you have stomach infection, maybe you have gut infection, maybe you have some sort of other GIT infection, so only doctor can assess that. Just like that, only a psychologist or psychiatrist or a trained person can assess whether it's depression or not. Another thing is that depression, mental health is not only is not as narrow or as small as we people look at. There are so many other problems other than depression and anxiety, and use the word depression. That person maybe suffers from OCD, maybe from schizophrenia, maybe that person has some eating disorders, maybe that person has some sort of behavioral disorder, maybe that person have neurodevelopmental disorder, maybe that person have some sort of sexual disorder. So the list goes on, and only just let the psychologist or psychiatrist decide whether the person has that problem or not, because there is a huge list of assessments and huge list of testing, and they use different internationally certified manuals like DSM-5, DSM-6 to assess whether the thing is present or not. Another thing that I want to talk about is a word that you have heard a lot is antidepressants. How bad antidepressants are, how you have tried to save yourself from them. Again, antidepressants is a wrong word, because antidepressants are just those medicines that treat depression if it's mild to moderate, and the correct word is psychiatric drugs, which are thousands of drugs, and they are not those drugs that gonna make you highly addictive on them. They're not addictives, they're not sedatives, they don't make you rely on them throughout your life. Just like antibiotics has the course for 5 to 7 days, same like psychiatric drugs have the course like 6 months, 12 months, and you have to complete them whether your symptoms are there or not. Also, we people are living in some sort of hyper-capitalist environment, and specifically in Pakistan, there is economic and social turmoil. So we have to consider that factors are obviously going to affect your mental health. So if someone finds some sort of aid, some sort of help in those medicines, just let them take those medicines, because they are totally safe, and we need to break those stigmas, we need to break those taboos associated, because if you ask those people like, have you used those medicines, 90% of will answer them, no, we haven't. Why we haven't used such medicines which are so bad for us? So instead of relying on stigmas, relying on taboos, relying on conditioning which is done by the society itself, and we know that at grassroots level how ignorant people are, we need to rely on logic, we need to rely on rationale, we need to rely on scientific research, and to make our lives better, to make others' lives better. If someone is having some sort of help through these medicine, if someone is getting better, just let them be. Just break those taboos, just break those stigmas, and let each other's and our lives better, easier, safe and sound. Thank you everyone. I hope this video will give you a little bit of information.